Welcome to the University of St. Francis School of Health Science Simulation Lab here in beautiful Fort Wayne, Indiana. Opening in 2007 with the support of Parkview Health, our 1,100 square foot state-of-the-art facility is home to Medical Education Technologies' family of human patient simulators. Behind the mirror in the control room, the simulators are operated by laptop computers. It's from here that I can make changes in their condition and the responses to patient care. We also have the ability to record simulated experiences and play them back later for the students and faculty. A recent addition is being able to transmit live feed from the sim lab into the classroom, making learning exciting and fun. Our simulation lab is equipped with a sophisticated monitoring system, suction, oxygen delivery, electronic medical records, a communication system, and barcode scanning. It's all right. It's okay. It's all right. Shh. Good. Good. Our infant simulator helps students learn about normal infant head-to-toe assessment, shaken baby syndrome, and congenital heart issues.
As a nursing faculty, I think that one of the most exciting things about simulation is seeing students make connections between the classroom and the real world. One of the simulations I use with pediatric nursing students is shaken baby syndrome. A seizure occurs during this simulation, and some students respond appropriately, while others are unsure. In debriefing, students and I review proper nursing care and seizure precautions. Students identify what was done correctly and what was missed.
Hi, I'm Delaney Francis. I'm 6 years old, and I want to be a nurse when I grow up.
Our pediatric simulator reflects the physiology of a 6-year-old child. Some of the experiences students have with pediatrics would be asthma attack and diabetic ketoacidosis. Students will adjust their communication and therapeutic approach to be age appropriate. They will correctly calculate medication dosage and creatively find ways to administer it. To make the experience realistic, students will find parents at the bedside, asking questions and wanting to help. The adult patient simulator is designed for emergency care. Its most outstanding feature is the ability to accurately reflect the physiology of 5 different body types. It can be programmed to reflect the physiology of a middle-aged standard man, a young adult, a pregnant female, an elderly female, or a chronically ill patient. The patient simulator can talk, bleed, and urinate. Some of the procedures and treatments performed are airway management and intubation, EKG rhythm, defibrillation and chest compression, chest tube insertion, urinary catheterization, central and peripheral IV fluids. A realistic feature of the patient simulator is its ability to respond to conditions. For instance, if you apply oxygen, you'll see the oxygen saturation rise. If the patient is bleeding, blood pressure will decrease.
The Code Blue scenario allows students to care for a client who experiences a cardiopulmonary arrest. The student who is the primary nurse in the scenario finds the client down, not breathing, and pulseless, and must activate the emergency response by calling the sim lab operator. The rest of the clinical group responds as the Code Blue team and practices emergency techniques such as airway management, CPR, IV push medication administration, and defibrillation.
The debriefing room is where students gather after a simulated clinical experience with their professor, who will guide them to reflect on learning, link theory and research to practice, reinforce positive actions, and evaluate the experience. They will often critique video recordings and laugh quite a bit at themselves. Debriefing is fun, and it's the most important part of simulation.
I really like to be able to see yourself afterwards, and it just gives you kind of that intake on how you're doing, what your classmates are doing, what you're doing wrong, what you're doing right. It's a really good environment to not worry if you're doing anything wrong or making mistakes. It's a good practice.
Picking up skills from the other students that are going ahead of me or behind me that I'm watching as well. So it's all working together to make our skills a lot better for our clients.
The part of the simulation process I enjoyed most was probably the part that was the most challenging, which was being put on the spot and being presented with your weaknesses so quickly. Another aspect of it that I thought was important was being able to get our hands on a lot of the equipment. You go through so much that's didactic that when you're actually given the opportunity to touch equipment, interact with a patient, even though it's a simulated patient, it makes you think about the things you don't know and the things you aren't comfortable with. So those two things.
Definitely the Code Blue simulation. It was very realistic. We weren't standing in there and somebody said go. We were all in here talking, and all of a sudden we heard a loud crash, which was supposed to signify that something had happened, so we run in, and Stan was on the floor. He wasn't laying in bed. It doesn't always happen like that. You don't always have him hooked up to telemetry to know. It's almost overwhelming, but that's really how it is in real life. Everybody rushes to the code.
The last simulation of the spinal cord injury, where I had to check the wound. It was a pressure ulcer on the patient's left heel, and I had to check that, and I made a mistake and used poor body mechanics, and I learned from that mistake that I had, and now I know what to do in that situation and how to measure the wound, how to measure what stage it's in. So now I know that I shouldn't mess that up again.
Some of my students who had participated in shaken baby syndrome were studying for a nursing exam a few weeks later. They were at one of the students' homes when her child began to have a seizure. The students took quick action by ensuring the safety of the child, timing the seizure, and monitoring vital signs.
2 students and I were on a clinical unit in a local hospital a few weeks after practicing the Code Blue scenario in the sim lab when a client on the unit went into cardiopulmonary arrest, secondary to an arrhythmia. One student quickly called the hospital operator to activate the Code Blue team, while the other student retrieved the emergency cart, took it to the room, and assisted the staff in applying the defibrillator pads. The client was successfully resuscitated after receiving 2 shocks. The students' quick response times and the active roles they took in the emergency situation on the clinical unit aided in the positive outcome for this client. Simulation not only enhances student learning, but helps to build student confidence and efficiency in performing nursing interventions in the real world.
Nearly 1,000 students are enrolled in a variety of programs in the School of Health Sciences. Physical therapist assistant, associate, bachelor's, and graduate nursing, physician assistant studies, radiologic and surgical technology students all have the opportunity to participate in simulated clinical experiences. The students are actively engaged in realistic learning experiences designed by faculty to simulate basic assessment to high-risk emergency situations. Our high-fidelity mannequins simulate human patients with spinal cord injuries, asthma attack, postpartum hemorrhage, and acute myocardial infarction, otherwise known as Code Blue, and many other conditions. The SimLab director and the assistant coordinate all the SimLab activities on a per-request basis.
This lab gives you the opportunity to begin practicing nursing or practicing medicine long before you have to be worried about the art of practicing medicine. And it's nice to be in a controlled environment where you can be uncomfortable and you can make mistakes, but know that you're not really going to hurt anybody.